So I would think moving forward, I would like to see us as a region determine what we think the problems are and have a common definition of what a problem is that we're going to fix or that we're going to work on. Trying to come up with an organization that brings us together, collaborates, figures out how to build linkages, and then works on a couple of 3 projects.
Financial sustainability is part of a pathway for the Medicaid population, recognizing that there's a cost to program delivery, and we don't want that cost to be borne on the back of the individual who's already struggling with access challenges. Access and equity, both in the physical space and in the virtual space, can be really valuable to continuing to have that kind of supportive net where we make sure that we can catch people where they are and get them connected to services that support them in lifestyle health.
We know we can't do it alone, and we know that we have to work together in our community to help solve these issues for our patients and our community members. And that's where we see OCH filling such a need for our community, is to bring all of us together to help take care of our community members, not just on the individual patient level, but on the population level as well.
I think even having more connection on some of our local efforts to also de-silo and really make sure that we're all pulling our oars in the same direction. You know, we have a local community health improvement plan that OCH has often participated with, but having them as kind of there all the time, I think really integrates our systems in a healthy way and would follow that de-siloing that I found really appealing. And I think OCH plays an important role in that and kind of connecting our different systems through Medicaid transformation and beyond, I think, as well.
I think the value of having a centralized body that's tracking what we're all working on so that we can align instead of collide is a huge value. And I do think there's an eye in the structure of how the OCH leads to think about what sustainability can look like from an infrastructure and payment model, so that we have, hopefully in a future state, some form of single service community information exchange that keeps us collaborating and not colliding, and has us move into a space of shared revenue and resources for sustainability.
A larger framework of looking at other social and economic determinants of health that I think broadens the conversation and is more outcome-based than a lot of approaches that I've seen before. So I think that the broadening of the conversation is an important feature that OCH brings to the table.
That ability and that place to talk with other organizations and solve problems once is, it's just, I think, at the heart of what OCH can bring that is unique.
I'm very interested in social determinants of health, and I want to work with our medical community and our human services community together. The place that I would really like to be involved in is looking at how do we take research, whether it's in adverse childhood experiences or other research, and then integrate that into what we do and how we do it in our communities.
I know that we're willing to put in, if we think there's benefit to an OCH and what OCH can offer, we're willing to help contribute to that funding.
I do think there's an opportunity for OCH to continue on after the Medicaid transformation project because of that role of being a community convener and bringing organizations together to collaborate.
I really commend OCH for including community-based organizations in these very complex problem-solving initiatives to community and population health.
I'm hopeful that there would be some funding sources that OCH could go after in order to continue this important work.